I think that you have some people in the C-suite who are very in tune with supply chain management, realizing that it can be a good partner in increasing quality, looking at all the Joint Commission, what they're looking at, all those different areas, improving the metrics. Then I think you have others in C-suite who don't think about supply chain management at all. It's really if something breaks, that's the only time it really comes up.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we speak with Will Gregory, Director of Materials Management at Finger Lakes Health. Will is in the process of getting his doctorate in healthcare administration, and he's got a research project that is going to evaluate how the C-suite perceives supply chain management. And so, Hayes, today we're going to learn about this arduous process and really what Will hopes to accomplish, as well as some of his background and why he got interested in this topic to begin with.
Yeah, Will's an interesting guy with his background. He's done a lot of different things. He was on the supplier side. Now, obviously, he's in administration and supply chain, doing some really interesting things. Please stick around. It's a really, really good interview and podcast today, and you might learn some new words today. So hang in there.
All right, stay with us. Up next, Will Gregory.
I'm Hayes Waldrop.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
We are speaking with Will Gregory, Director of Materials Management at Finger Lakes Health, and we're going to be talking about the perception of healthcare supply chain and the impact on patient care. And we're also going to learn a little bit about what you're working on right now, Will, which is the doctoral thesis and research. So we're going to use that as a teaser and save it for maybe the closing section of the interview. And first, I just would love for you to say hello to the audience and tell them what you're doing in your current role at Finger Lakes.
Yeah, thank you. So my name is Will Gregory. I'm currently the Director of Materials Management up here in Finger Lakes with a smaller regional health system. So it's more community-based healthcare up here. We have 2 hospitals, an ASC, some physician practices, so we're much smaller. But yeah, over here, wear a lot of hats since we're smaller. As head of supply chain, work as Director of Materials Management, reporting directly to the C-suite, have oversight of purchasing, contracting, biomed, value analysis, laundry and linen, and nutritional services and dietary also. Yeah.
Well, it's funny you say that. I've had a lot of conversations with people recently because of the impact that these financial pressures have had on, rural hospitals and rural health systems and communities. And one of the resounding conversations is we wear a lot of hats. And I think you just described a lot of different hats that you're wearing. And so what's interesting too is you have a lot of experience in this industry, which is something that you're bringing to the table. But in a lot of cases, people that are in your role in other rural care delivery models don't have that experience base. And so wearing all those hats can be a challenge for them, especially if they're early or newer in their careers.
Yeah, I think it can be. With one of these small organizations, you get involved in a lot of different things, pull in a lot of different directions. Originally, I got my start in manufacturing. I finished college with a degree in philosophy and minor in literature. And so, like most philosophy majors, I went to work in a factory right out of school. Yeah.
Oh, that's like the real typical path.
So, but that factory was for a medical device corporation, Thermo Medical. So I worked there, and after being there for a little while, someone in HR said, "Will, we have this entry-level position over at corporate over in Jersey. It's for a contract administrator role. We think you'd be a good fit. Why don't you, apply for it and see how it goes?" And, I did apply, and it seemed to be a great opportunity. It was very different from a factory role, though. And Terumo, that's a big international corporation. However, this division of Terumo was very small. So over there, I was the entire contracts department. So it was just myself reporting into the head of sales and another point head of marketing. But it was a good experience. Had oversight of Canada and the United States and Puerto Rico, those areas, and focused on their medical devices, a lot of their commodity products. But yeah, it was a good experience. Supply chain management, that's a big umbrella term, really incorporates a lot of things. And, contracting is one of those things. But yeah. And from there, went to work with Olympus for a while and started up Allsbury Health GPO and worked at UPenn a bit. And now find myself over in upstate New York working in Finger Lakes.
So, Will, I like the fact you're like, I'm covering the U.S., contracting when you first started, that you don't have a lot of people to reach out to and you got to report to. I'm getting things done. Don't you think, and kind of share a little bit more of your experience, like that opportunity, when it does come, you either can accept it or you can just kind of be transactional and task and check the box. But you learn so much if you choose to, right? That's the person you got to kind of be in supply chain. I'm wondering if that's how you took it on and what you learned has gotten to where you're at right now. So this maybe visit a little bit about that perspective.
Yeah, that's a good point. There's always opportunities to go above and beyond, always opportunities to ask to do more. How can I add value to the process? You never want to say it's not within my wheelhouse. It's always how can I bring value to the organization, and that involves learning and growing. And yeah, it's a great opportunity. You learn a lot along the way, and I think that just leads into wearing all those different hats potentially.
So, Will, what is the focus of your research for your doctorate? What are you trying to accomplish or learn?
Yeah, thank you. So having been on the business side of healthcare and then moving over to the hospital side, I felt like I was very in tune with a lot of the business aspects, a lot of the finances, the contract and negotiations. But I felt where I was falling short sometimes was in my knowledge of the world of healthcare itself, quality of patient care, that sort of thing at times. So I wanted to pursue further education. I thought that a master's already, have one of those, two of those. So I thought, why not go for a doctorate? And I thought healthcare administration and being in a healthcare supply chain, I wanted the focus to also pull in healthcare supply chain. So, going for that doctorate, mentioning to people, I'm in healthcare supply chain. A lot of the other students, some are dentists, some are administrators, COOs, that sort of thing in the program, but very few people are involved in the world of supply chain management. And the reactions have been sort of mixed. Some of the professors will be like, "Oh, Will, I'm very glad you're here. Supply chain management, that's very relevant to healthcare. Healthcare supply chain management, absolutely." Then there's other professors who are like, "Well, I don't really understand why you're here, why the focus of your doctorate would involve supply chain management." So it's very mixed reactions. But my focus of my doctorate for healthcare administration is really on the quality of healthcare, how healthcare supply chain management brings quality to patient care in United States hospitals and how that's perceived by administration in those hospitals. So that's really the focus of what we're looking at.
Yeah, it is wonderful. The first time in a long time, I think you have administration's, attention if you're working in supply chain today. But that perception piece is also really important, right? And why is that?
Yeah, so I think it's important for number of different reasons. One of them, I think, is funding. If you have more eyes on supply chain management, then hopefully the dollars allotted for supply chain management for the personnel will be there to grow the department. I think when you're in supply chain management, everyone knows of ways to do things better. And sometimes to do things better involves additional headcount, additional systems, additional applications. Not always, but I think that there's always value adds that can be brought about through additional people and programs and those sorts of things. So I think one of the reasons, additional funding potentially, and also, additional visibility to supply chain management, different ways for supply chain management to partner with other departments within the organization and bring additional value and improve the quality of patient care. So I think there's a few different reasons for it.
Have you found, obviously your management, the people that you work for, they know that you're doing this, right? So they've got to be excited about that. And is there some give and take there? Like, this is what I hope to do, or how does that work in their involvement in your studies?
Yeah, administration here, they've been a great resource, definitely in terms of bouncing ideas off of them. But yeah, they've been very positive, very supportive. It's been all around a good experience being here.
You talked about that perception, and I think a lot of times too, how we perceive ourselves gets projected out and helps form others' perceptions of us or the work that we do. Let's start at a baseline on this, and maybe this is already part of your research. How do you think folks that are working in supply chain perceive themselves today?
Yeah, I think that's a great question. It's very mixed. I think you have some people who are very in tune with it, who believe that supply chain management is part of the quality of patient care. I think you have other people who don't really connect with the idea that at the other end of every medical device that we bring in or source, there's a patient on the other end. Some people may view it just as transactional, placing orders, and they don't really view their responsibilities going above and beyond that. It's placing orders that clinicians want, ensuring they get here on time, ensuring they get to where they're supposed to be. So it's very mixed. You have some people who are adamant that they are not part of supply chain. They are part of purchasing, or they're not part of supply chain, they're part of value analysis, or they're not part of supply chain, they're part of the storeroom. But supply chain management can be very siloed at times. I think it's important to sort of bring it all together under the umbrella of supply chain management. And, that's relatively a new term. I don't think it was coined until really 1982, supply chain management. And when you're dealing with supply chain management in hospitals, it's not always cutting edge as some of the other industry sectors. So I think that supply chain management in healthcare, it's sort of getting there, but we're not quite there yet.
Well, you said 1982. Gary, were you born then?
Oh, you know what? You were probably walking me to the bus when you were 21. I mean, that's really what happened to go to school in kindergarten. So thanks, Hayes. I appreciate it.
I didn't know y'all had schools out there, but okay.
1982, man. I'll tell you what. Well, hey, I'm going to come back because we're talking about people, Hayes, and you brought it up. But Will, you said the patient. We all affect the patient. You brought up mission, which, that's my bailiwick. That's what I want to jump on my stump speech every time. And I think I want to know from your perspective, when you're talking about procurement, you're talking about purchasing, implementation, saving, supply chain management across the board, and you're talking to your teams, even wearing multiple hats. Do you get that emotional buy-in with your teams by focusing on that and bringing it up on a regular basis? Like, missions right behind me, it's the patient we're serving. Do you use it a lot in your dialogue?
I try to. I think the patient focus and the mission is very important. I think that a lot of the times that can be lost sight of. And I think that really goes a long way, too, about what are we really doing here? Are we doing here just to check the box and get a paycheck, or are we here to better support the quality of patient care? You can't lose sight of the patient, even though we're in a role that's not patient-facing. If you're not patient-facing, if you're in accounting or you're in the storeroom or you're sitting in an office somewhere, never seen a patient, I think it's easy to lose that focus, but I think it's important to keep that focus.
Well, it's imperative. I mean, same thing. You can say the thing about, Ford Motor Company. Well, you might be working, in finance, but guess what? You're ultimately putting that car on the road, right? You have to have pride in what you do. And so I think, good leaders develop that. And I'm sure you're doing that for sure.
Thank you. Yeah, trying to. Yeah.
We had a really good interview towards the end of last season with Lisa Farmer, and she talked a lot about making sure that the staff understood that they could have a patient experience of their own and making sure that they got that connection to accomplish exactly what you're saying, to really feel like they're tied, to what the organization is trying to accomplish in terms of patient care. We had another really great interview. Now I'm going back over a year, I think, but we had Derek Gallagher and Rachel Anderson from YPAC on. I'm sure.
Superstars.
I know you're familiar with them. Yeah, I know you're familiar with them and YPAC. So one of the things that we talked to them about was this concept of turning supply chain management into a destination career instead of, like you kind of described and we were commenting on, falling into it. What are your general thoughts? Do you want to kind of add some context to that, especially as it relates to your research?
Yeah, thank you. I'm one of those people that fell into it. I never, growing up, knew what supply chain management was. When I was growing up, I wanted to be a Catholic priest. So I actually went to the seminary originally, Catholic seminary. So it's a 9-year program, went halfway, finished the undergraduate portion, and decided, life of celibacy, this doesn't really appeal to me. So it was a good breaking point with the undergraduate. Left. But supply chain management, you can go into so many different fields with it. When you think of cutting edge supply chain management, I don't think anyone really thinks about healthcare. And I recently looked at some survey, I think it was ASCM, Association of Supply Chain Management. They had salaries on average across all these different industries, and healthcare was towards the bottom. So if you're going into supply chain management as a college student and your focus is the money, compensation, then probably healthcare isn't going to be a destination for you. But if you have the mindset of, I want to go into healthcare, and also I really want to support patients, help patients, and also be a good steward of how the organization's finances, then I think you can reframe that conversation and then have healthcare supply chain management then be sort of a destination career. But I think it's all about framing what's important to the people. Is it the money? Because if it's the money, you're not going to go into healthcare supply chain management. If it's about helping the organization and patients, then I think we can frame it as, yes, it is a destination.
There's something that you said earlier, too, just about being in your program. And, you've got a couple of masters. So, you're going back for this healthcare administration doctorate, right? That's program. But I don't know that healthcare administration undergraduate programs focus a lot on supply chain. And I think sometimes that degree is so global that somebody comes out, and I'm thinking of somebody very specifically that I know that got that degree and wound up working in sterile processing and then slowly climbing up into management. And now they're a VP of Periop, actually in our area, the greater Philadelphia market. So our neck of the country. But that was not something, sterile processing wasn't something they thought of. Getting in the business of healthcare was, and they kind of climbed through that path. I almost wonder if some curriculum to expose anybody who's getting a healthcare administration degree to the business of healthcare supply chain management as an entry level, pillar for them to then, move as far as they want to take their degree. Maybe they stay in supply chain. I feel like that's something that could really have a good impact on the shortages and, just trying to find good talent to join our teams across the country.
Yeah, I think that's a very good point. Going through my program, I finished all the classes with it. Right now, I'm just working on the dissertation piece. And with the classes portion, supply chain management was just, a few paragraphs in one course. It was very much just, yes, it's here. You should know a little bit about it, but that's pretty much it.
But no baseline level skills.
Yeah.
Right? Yeah.
Yeah, but I agree with you. I think a lot of these healthcare administration programs could benefit from maybe a course, and if not a course, at least a greater focus on what supply chain management is and its connection to the quality of patient care, how supply chain management can be partners in improving that care. And yeah, I think you're absolutely correct.
You know what, Will? I see in your features, you're going to be one of those professors teaching that's just, I mean, you can still do your job
all day long,
but
I was thinking the same thing.
You're going to be ideal for that.
Yeah, thank you. Yeah.
You're built for that for sure.
Dr. Gregory. Yep.
So let's tie this back to that administration, right? And getting that C-level attention now that, you're kind of focusing on some of that. What are you learning and how do you think the C-suite does view supply chain? Obviously, there's a lot of variability, but I'm assuming you're getting a lot of touch points and feedback on that in your research.
Yeah, I think you're absolutely correct. There is a lot of variability. I think that you have some people in the C-suite who are very in tune with supply chain management, realizing that it can be a good partner in increasing quality, looking at all the Joint Commission, what they're looking at, all those different areas, improving the metrics. Then I think you have others in C-suite who don't think about supply chain management at all. It's really if something breaks, that's the only time it really comes up. Then you have others who view supply chain management as a cost-saving tool, and it can be. But I think if you're just limiting it to just cost savings, then you're limiting the value of supply chain management. So I think it's really across the board.
One of the things that I think is a signal to some areas that the C-suite is paying a little bit more attention. And I think a lot of it is directly related to the CFO. And the supply chain has traditionally been very much focused on cost savings, but the CFO is also looking very much at revenue and revenue generation and the payers. And so their eyes and attention go in a whole lot of other directions. I feel like there are now some revenue generating opportunities that present themselves under supply chain management. And I also think that the CFOs recognizing that where they might not have, like, here's your goal. You got to save $1 million for the organization this year. Even if you had a revenue generating opportunity, it's just not even aligned with what the CFO is asking you to do. I think that's changing. Have you seen that?
Yeah, that's a good point. I think that you're absolutely correct that there are some revenue generating ways that supply chain management can help. Yeah, I have seen some more of that. I've also seen supply chain management really branch out too. There's recently purchase services that seems very hot right now, especially in the past few years. Whereas originally when I got into this, that was never talked about. So I think there are a lot of different ways that supply chain management is sort of evolving and growing, and definitely revenue generation can be one of them.
All right, so let's dig into the research. How are you conducting the research? And, what are you hoping to learn? Or maybe you're going in. I was always told, don't ask a question you don't know the answer to.
I do that every day.
And I realize, yeah.
like every question I've ever asked here. That's the purpose to ask, isn't it?
Oh my gosh.
Bing, bing, bing. There's a winner.
That was money. That was money, Hayes.
All right.
So is there anything that you kind of expect to learn from the research? Like, you have to have a hypothesis, right?
This whole year has been devoted just to the dissertation portion of it for me. I finished all the courses, and they divide the dissertation into 4 parts. The first part is just about, the introduction. Why is this an important topic? The second part is the literature review, and that's pretty lengthy. I had to find at least 100 peer-reviewed academic journal articles, and those can be anywhere from 4 pages to like 35, 40 pages. Read them all and summarize each one of them and find at least 100 of them that are applicable to this research.
Wow.
That sounds like Chat GPT to me right there,
Oh boy.
I mean, I'm not just saying, just game the system a little bit there.
Yeah. The third part of it, which I'm currently in now, it's putting together the roadmap of exactly how I'm going to do the in-person study. And that in-person study is going to be conducted via Zoom. I'm trying to find anywhere from 15 to 20 healthcare administrators throughout the United States from all the different AHA regions and try to talk to them about their views. So it's a qualitative study where I'm interviewing them and trying to better understand their lived experiences, really delve into that and understand their point of views, their experiences with healthcare supply chain management, how it relates to the quality of patient care, how they perceive it relating, how they perceive healthcare supply chain management impacting finances, and just have a conversation. And once we get all that back, do a coding verbatim, transcription, code it all, try to find themes and analyze the research. So it's been about 8 months into it. It's still pretty much at early stages. So later on tonight, I meet with my dissertation committee and I actually do a defense of the proposal of the study. So that whole scope can still shift. So, but at the moment, this is where.
So what you're saying today may be different by the time the podcast goes out, depending on what they think tonight. Literally tomorrow.
Yeah, definitely. Yeah.
Well, good luck to you on that.
Thank you.
How do you think they would shape it? If you go in and defend this, because this sounds like an arduous process. Like you're going to earn it, when you get some results from this research, there's no doubt. What kinds of things, I'm sure you're doing some prep and expecting them to give you certain feedback or challenge things just by virtue of making sure that they're helping you maintain the integrity of the direction that you're going, right? So some of it will just be part of the process. What could change? What areas do you think they might, try to lead you in another direction on?
Yeah, so I know recently they started to try to lead me towards not just quality, but also bringing in the finances, the cost savings aspect of supply chain management. Where I'm currently at, everything is extremely structured. So, for example, soliciting participants, I'm not at that stage yet, but I have to have exactly, here's the email or message I'm going to send them to solicit, the exact wording. Here's the follow-up exact wording of that message. Here's, the exact wording of the questions I'm going to be asking for the research interviews. Here's the exact wording of the prompting questions in case they're needed. So everything's very structured. So all that is very much subject to change. But I'm feeling pretty good about where it's going at the moment. Yeah.
All right. Well, good luck tonight. And this isn't the only big project you're working on outside of your daily responsibilities. You're also pursuing your fellow designation for AHRMM. So tell us about, what goes into that. And also, would love to give you a congratulations here once you earn that status.
Oh, thank you. Yeah, it's very much the beginning stages. I applied and they approved the topic. And the topic is positioning the healthcare supply chain to be seen as a partner in improving cost, quality, and outcomes by hospital administration. So it's sort of in the same current as the dissertation. This one's looking more at the silos in healthcare SCM, differences in terminology, how to communicate our value to administration, how to communicate value to staff, how to communicate it externally to bring in some of those outside organizations like HFMA, ACHE, AHVAP, a lot of those. How can we position healthcare supply chain management to be seen in the way we think it should be seen? I think that if, for a lot of people, perception is reality. I don't buy into that completely, but I think there is some truth to it. And how is healthcare supply chain management being perceived internally as well as externally? If we don't tell people who we are, people are going to tell us who we are. So I think that we have to sort of frame the conversation and tell the organization and outside of the organization who we are as healthcare supply chain management.
Excellent. Well, Will, good luck on the research. Good luck with the fellow designation. And honestly, I hope the research makes an impact and continues to, I don't want to say increase or change the perception, but just maybe increase awareness, not only for the C-suite, but, how the industry is perceived by the C-suite so we can continue to bridge that gap. We've actually got an interview coming up that we've lined up with somebody who works for HFMA. And so, that's the organization that many CFOs belong to. They've definitely been trying to pull in a lot more supply chain representation and engagement with the group. And so I almost think that some of that financial direction you're getting could also be somewhat influenced by that, because I think that there is a lot more C-suite awareness, involvement, desire to understand better. And now's the time to really capitalize on it and elevate the profession, throughout the organizations across healthcare.
Yeah, absolutely. There's a lot of great organizations out there. A lot of times being in supply chain management, we look at AHRMM, which is an excellent organization. But there are other ones, like you mentioned, HFMA. I'm a member of that organization. I'm a member of AHVAP for value analysis, and also ACHG too. So I think there's a lot of good organizations that overlap in a lot of ways that is healthcare supply chain management we can partner with.
100%. Absolutely. We all need to do our part to get supply chain up. And unfortunately, it's improved dramatically in the last, 5, 6, 7 years. But we appreciate what you're doing. And thanks so much for coming on, Will.
Yeah, thank you for having me.
That was Will Gregory, Director of Materials Management at Finger Lakes Health. And Gary, good luck to Will tonight. Obviously, that'll be completed by the time the episode gets released. But doing a research project, going for your doctorate, it's not an easy feat. I'm interested to see once the results come out, what is the perception of the C-suite of supply chain? Would have been great if we could have almost had a benchmark from 10, 15 years ago to see how that might have changed, or maybe that's part of his lit review and it'll come out, in his summary.
Yeah, I don't know how he's going to accomplish it. It seems like so much to gather in 1 year to 2 years to 3 to possibly 4. And the movement of supply chain and how quickly it's changing, like trying to keep up with all that, it's just turning and burning right now. So I'm curious to see where this goes. I think one of the things we will see with soon-to-be Dr. Will is we're going to see him publishing all kinds of different articles down the road. I'm going to call it right now and say probably in 2025, we're going to see his name in some category in AHRMM, HFMA, ASHI, wherever it is. But he's living in the midst of supply chain as it evolves right now. So it's interesting to see that academic side that he brought to the table today.
Yeah, I really like that he's involved with all those different professional trade organizations. It helps broaden his view as well.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.